Hi, Dr. Pelto here. I had a patient ask me the other day, is it really possible to fix my plantar fasciitis or fix my heel pain in only 2 visits? And I've had a couple of patients over the years that have gotten better in only 2 visits. And I want to explain kind of what the main similarities are in these patients. So usually these patients, when they come in, they're very motivated to get better, and they usually haven't had pain for a very long time, so maybe less than 3 months. In a lot of these patients, let's say they've gone to Disney and they've done a lot of walking, and then all of a sudden their heel pain starts. They've never had it before. For a lot of these patients, the problem is there's inflammation in the bottom of the heel, and then there's tightness in the back of the calf. So what do we do in this case? So the first visit, you usually get an x-ray, and then you get an ultrasound that can show the thickness of the fascia. If there's not a lot of thickness, okay, and there's a lot of pain, I have this little routine that I do for patients. So the first thing is I have them do contrast baths, and I have them do anti-inflammatories, and that first day with the ultrasound, I'll put a little cortisone in there. Okay, I don't do cortisone for a lot of patients with heel pain, but for the ones that haven't been there that long and they don't have a lot of thickness in the fascia, I find that this will calm things down. Okay, and they're going to do some anti-inflammatories for a couple weeks. Then they do a morning stretch before they get out of bed. They do some foam rolling in the back of the calf, and then I give them a night splint, and then they put those shoes on when they're at home around the house. And then the third thing is I have them get a new pair of shoes, a good pair of shoes, and we scan them for orthotics. And then for these patients, they do this home exercises. I see them back in usually it's about 8 weeks, because they have to get the orthotics in when they come in. And then when they come back, if they're better, I don't need to see them anymore. That's not the majority of the patients, but there are patients that are motivated, that are willing to do these things, and they just want a quick fix. That works for them. Now, if it comes back or not is a different story. Time will tell.